thank you so much for being here. Dan is with the Steve Drumler Hope Network, and he is here to talk about overdose response training and identifying and reversing, an opioid overdose. Dan has worked in the field of substance use disorder since early 2023, doing peer recovery, harm reduction, encampment outreach, and as a community health worker. He has additional experience in the nonprofit space and is in the field of information technology, where he has held analyst, business analyst, support, and consulting roles. Dan has lived experience with opioid use disorder and substance use disorder, and he is an overdose survivor. He has been in recovery since July 2021. He is passionate about his work and excited to serve the community. In his free time, he enjoys the outdoors, music, hobbyist tech projects, photography, and helping others achieve their potential. So let's give Dan a round of applause and thank him so much for being here today. Thank you, Dan.
Thank you so much.
We're getting him suited up. It's perfect.
Before we get started on this today, I wanted to start off on a high note here and bring in a member of the audience up. Damon, if you wouldn't mind standing up for a second. Damon had 3 years of sobriety today, or recovery, I should say. And I think that's a really exciting thing, and that's sort of kind of the reason why I do the work I do. He's in the space as well, and Damon has been a really big support for me. He's an inspiration, and that's really sometimes a lot of courage and hard work and dedication and a lot of hard times to make it through to get to where he's at. So congratulations, Damon. All right.
Thank you, Dan.
And I feel like I was introduced pretty well already, but yep, Dan Kelly with the Steve Rumler Hope Network, and my title there is Overdose Prevention Director. And as you'll see, we've got 3 programs. And so I'm going to kind of just dive right in here, actually. But I just have to say, we do have to actually move somewhat quickly because there's actually a lot to get through. I want to make sure we get through it all. And this is broken up into sections, so I will try to stop in between sections to see if anybody has questions. If you have an urgent one, feel free to raise your hand and I'll call on you. But otherwise, if we can save as many until the end as possible, that would be great. And there's going to be a certificate of completion that you can get at the end of the training today that will get emailed to you. And the way to get that is you'll have to fill out a survey with your phone, and there will be a QR code to scan, so I'll point that out. You can also get CEUs that way for a variety of professions, so if that applies to you, remember that. In today's presentation, you'll learn about the Steve Rumler Hope Network, the opioid crisis and current statistics, also opioid overdose and naloxone administration. Just a quick warning that we do talk about drug use, overdose, and needles, so if anything makes you feel triggered or anything like that at any point, feel free to do what you need to do to take care of yourself, even if that means stepping out or whatever the case may be. And also, it's not a CPR class. I do have to mention that, but it can be easy to confuse because we talk about rescue breathing, but CPR includes quite a bit more than this stuff here. But CPR is a great thing to know, too. If you don't know that, I would highly advise you to learn it. And you can reach out to the American Red Cross, and there's a variety of places that you can learn that. Our namesake, Steve Rumler, battled both chronic pain and opioid use disorder. After a severe spinal injury, he developed a dependence to his prescribed pain medications. And despite years of treatment, Steve's life was lost to an accidental overdose on July 1st of 2011. And Steve's loved ones created the Steve Rumler Hope Network in his memory. And our mission is to heighten awareness of the opioid crisis, address its impact on the physical and emotional burdens of addiction and chronic pain, and improve the associated care processes. And we fight the opioid crisis through our 3 programs: overdose prevention, advocacy, and education. Okay, I'm not sure what's going on here. That's probably going to happen again. And why we're here today. The Steve Rumler Hope Network provides training to educate audiences on how to identify opioid overdose and use the opioid overdose reversal medication naloxone. The more people who are equipped to use naloxone, the stronger our community safety net becomes. And to date, over 37,000 individuals have been trained through our overdose prevention program, and we're excited to add you as well. And I want to mention, too, that I brought enough naloxone kits with me today for everybody to get one. It's a life-saving medication, also called Narcan. It's been used to save my life. I'm an overdose survivor. I believe Damon is as well. If we get time, maybe he can share a little, but I'm just not sure if we will or not. So I'm going to get into some statistics here. We'll talk about the opioid crisis. I'm going to start with some national ones. So some of these are pretty shocking. Drug overdose is the leading cause of accidental death in the United States. And actually, it's the #1 cause of death for individuals aged 18 to 45. In 2022, there was over 84,000 fatal overdoses involving opioids. That's about a person every 6.5 minutes. So pretty much since we've been talking, or since I've been talking, we've lost somebody. Since 2000, more than 725,000 Americans have lost their lives to an opioid overdose. And this little chart right here is comparing different crises. It's not to downplay any of them. They were all horrible, obviously, but just to give you an idea of the scale and scope of it. And the outermost ring is drug overdoses between 1999 to 2022. And 60% or higher of those are opioid overdoses. And then the next ring in here is the AIDS epidemic. And then finally we got World War II, World War I, and Vietnam. So you can see it's more than World War II and World War I combined. And it's an evolving crisis that's occurred in waves. So these years that you're looking at here are just the different waves of the opioid epidemic. The first wave was in the 1990s. Opioid use was driven by overprescription and diversion of prescription medications. Very dishonest marketing. In fact, they were saying things like OxyContin were non-addictive even, which is obviously the exact opposite of the truth. And so, eventually there started to be more awareness about that, and they started to crack down on that. And so the prices and the ability to get your hands on opioid prescriptions was more difficult. Many people were dependent on them, so they had to turn elsewhere to get their needs met, and they turned to heroin. And that was between 2010 to 2013. Started to see heroin-related overdose deaths rise. It was just a cheaper and more readily available alternative for use. And very quickly after that, started to see the rise of synthetic opioids. Of course, fentanyl is one of the synthetic opioids. There's many others. But they became the primary driver of overdose death. And that brings us to today, where we're in a fourth wave of the opioid epidemic. And there's not a total consensus yet on how to characterize that, but generally what it seems to be is the pandemic played a big role in isolating people and causing pretty much like a worldwide mental health crisis, which caused some people to use substances more, and that played into the opioid crisis as well. And the other thing is that we really only used to see fentanyl being used as a cut for heroin or a way to make it stronger, but nowadays we're seeing it everywhere. So right around that time we started to see it showing up, especially in stimulant drugs like meth and cocaine, but there's also pressed pills that look a lot like something you might get from the pharmacy, but they're not from the pharmacy. They're made by the cartel and they contain fentanyl. But all these things have significantly increased the risk of accidental opioid exposure and overdose. And this is the waves of the opioid epidemic graphed out. That's between 1999 to 2022. And you can see right there is when synthetic opioids happened, and boom, look how much worse it got. And this is just showing any opioid, other synthetic opioids. Commonly prescribed opioids is interesting because it kind of stayed elevated, and you can see it tick up here. But the main thing is that heroin is being replaced by synthetic opioids. And I think that's probably against the wishes of many people who use drugs. They would probably rather use heroin, but it just simply isn't available. So to get into some Minnesota statistics, synthetic opioids continue to drive rising overdose rates in Minnesota. There were 1,028 opioid-involved overdose deaths in 2022, and 9 out of 10 of them involved synthetic opioids. And fatal overdose rates remain high, but they've leveled out after years of rapid increase. You can see that here shown in this graph. And we're seeing promising numbers for this year, actually. So hopefully we'll start to see this go down, and we won't be out of the emergency, but at least that's promising. So synthetic opioids are manufactured substances that mimic natural opiates. They're cheaper to produce, and they're much more potent. Fentanyl is one of the most common. It can be 50 times stronger than heroin, and it's used to lace counterfeit pills, cocaine, meth, heroin, and more. And a fatal dose can be as small as 2 milligrams. And these vials here on the right is comparing potentially lethal doses of a few different substances, and so enough to potentially kill somebody. And the vial on the left contains heroin, and then we've got an equivalent amount of fentanyl in the middle, and you can see how much less it would take. There's not much in there. And then finally, we have an analog of fentanyl called carfentanil, which is actually used as an animal tranquilizer. It's an elephant tranquilizer. But it's been illicitly produced and found on the streets, actually. And you can see that's only like a grain of salt-sized amount in there, so not much. And that makes it very dangerous. And we do offer fentanyl test strips, and I'll talk more about those later on here, though. It's important to remember this crisis affects everyone, but it doesn't affect everyone equally. The opioid crisis disproportionately impacts communities of color, and Minnesota has some of the worst disparities in drug overdose mortality in the country. Black Minnesotans face 4 times the risk of opioid overdose death than white Minnesotans, and American Indian Minnesotans face 12 times the risk of opioid overdose death than white Minnesotans. But it's important to note that the rates of substance use are actually similar across demographics, and the reason for these disparities is health inequities. And you remember looking at the previous graph, how much worse the opioid crisis got. This is between 2018 to 2022, showing those disparities widening as the crisis got worse, which is just a really big tragedy. The effects of racism in America complicate substance use in communities of color, cause broad health inequities, and pose additional risk for fatal overdose. Systemic barriers in health services can prevent someone from receiving appropriate treatment for substance use or other health concerns. And there's also a lack of culturally responsive services. Representative providers can be an important part of effective treatment, therapy, and care, and increased demographic diversity is needed in these fields. The healthcare industry is predominantly white, and that creates a disconnect for a lot of people that can come in many forms. That could be a language barrier, that could be a cultural disconnection. So there's a lot of ways that this can happen. And we do have things in place to help, like person-centered care, but there's still a long way to go. There's also a variety of risk factors, trauma, financial hardship, generational trauma, just to name a few. Persistent inequities in the social determinants of health influence overall well-being and are key risk factors for substance use and overdose. The social determinants of health is like a broader way of looking at our health than what maybe we're typically used to with like Western medicine, where they give you a diagnosis and then here's how we're going to treat it. There's other things that play into our health, obviously, and that's kind of in the spirit of this whole thing we're doing here. There's stuff about the safety of our communities, there's our support networks, there's so many things. So also stigma. So people of color may encounter additional in-group and out-group stigma for their substance use, which can be a barrier to seeking support or treatment. And I think anybody who has struggled, I'm speaking for myself here, but I think it's probably the case for anybody with a substance use disorder or really who has struggled with any kind of mental health issue is probably pretty familiar with stigma, but it's worse for some people. And then finally, a distrust of emergency services may deter people from seeking treatment or seeking emergency assistance in the event of an overdose. But it's not all grim statistics either. We are making an impact. In 2022, there was about 5,650 emergency room visits for opioid-involved overdoses, but that's compared to 1,028 fatalities. And many more deaths were prevented by individuals getting naloxone in medical care. And I mentioned a distrust of emergency services on the previous slide. Sometimes people don't call 911. We want them to do that. That's the safest thing to do. But sometimes there's a distrust, and even a couple of my overdoses, we didn't call 911. So you got to imagine, actually, sometimes the numbers don't say everything. And as many kits as we get out there, I imagine there's probably a lot of overdoses that get reversed and lives saved, and they're not captured by the numbers. So I'm going to get into the training portion here, but I'm going to take a sip of water real quick. So in this section, you'll learn how to recognize the signs of an opioid overdose, what naloxone is and how it works to reverse an overdose, and how to give naloxone to a person who has overdosed. So when someone takes too many opioids, it causes their breathing to slow down, and as their breathing becomes slower and more shallow, they become very sleepy or unconscious. Then low oxygen levels begin to cause damage to the heart and brain, And if untreated, breathing stops entirely and eventually the heart stops too. And this graph right here is showing that phenomenon during an opioid overdose playing out over time. This is vital signs over time. And normally we're up here and our body does everything for us just fine, but it's altered and the respiratory rate begins to decrease. And this red part is showing if the heart stops. If someone's heart stops, that's a big problem because this, obviously one thing is it means that they're dead, but beyond that, the heart needs to be beating for this medication to be carried to the brain where it can work. So just to mention CPR again, it's a great thing to know because if someone's heart just stopped, then you could help them with CPR because then you'd be given chest compressions. But that's not the subject matter of what we're talking about today. Looks like my mouse is too far out there. So this yellow dot is showing, okay, we're going to intervene right here. The person has stopped breathing, the heart is still beating, and it's comparing the effectiveness of a few different kinds of interventions we could do. And one thing you can do actually, and remember this because it's life-saving information, but you can just breathe for somebody. If you didn't have naloxone, you can keep someone alive for a long period of time by doing that. The next most effective thing would be to administer naloxone. But the most effective thing you could do is to administer naloxone and give the rescue breaths. So that's what we advise that you do. A person who has taken too many opioids may exhibit any of these symptoms. They may be unconscious or unresponsive, difficult to wake up, have slow or shallow breathing, very small pinpoint pupils that are unresponsive to light. They may also be struggling to breathe and making gasping or gurgling sounds, have a slow heartbeat or lowered blood pressure, and skin discoloration due to a lack of oxygen, and that can vary based on skin tone. So naloxone is a medication that's actually been used for decades to reverse opioid overdose. It wasn't so available in many of those decades as it is now, luckily. But the way it works is that it acts in the brain to immediately block the effects of the opioid the person has taken, and it lasts about 30 to 90 minutes before it's cleared from the body, so pretty quick acting. And the way it works is it attaches to the same receptors in the brain as opioids, but it has a stronger bond with them. And naloxone knocks the opioids off the receptors and blocks any additional opioids from bonding with the receptors for 30 to 90 minutes. And this reverses the overdose and can allow the person to breathe again. So naloxone can reverse an overdose caused by opioids. So that can be anything in this list. I'm not going to read the whole list. There's actually a lot more opioids too that aren't even on here. But it will work for heroin. It will definitely work for fentanyl and carfentanil. Sometimes people ask us that. Any kind of prescription opioid pain medication like Vicodin or OxyContin. Nitazines is a new kind of synthetic opioid that we're worried about, but we haven't seen too much of, luckily. Certainly something like methadone it'll work on, but it's not going to work for something that's a non-opioid drug like stimulants like cocaine, meth, Adderall. It wouldn't work for an alcohol overdose. It's not going to work for benzodiazepine anxiety medications like Valium or Xanax, and other substances like xylazine. I'll tell you what xylazine is because it does affect our metro area here, and actually xylazine is a different kind of animal tranquilizer. It's not an opioid one, but it's being used right now to cut fentanyl. So people who are intending to use fentanyl, who are seeking fentanyl, unfortunately most of the fentanyl out there contains xylazine now. And it's really kind of a nasty drug that is causing people to have big open wounds that kind of just randomly pop up on their body. So there's a lot of wound care kits and things being done to try to help, but it's really kind of alarming. But here's the thing. Although you might not know what the overdose is from, it may still be beneficial to administer naloxone because if opioids have been taken in combination with other drugs, removing the effects of the opioids could reverse the overdose. And those are called polysubstance overdoses, which are very, very common. And one reason why they're so common is because a lot of times people want to do one drug, but there's more than one drug in whatever they're getting. So it's almost unavoidable sometimes. And as with any medication, there's a very small chance that someone might be allergic to naloxone. This may result in a rash, hives, or swelling of the face, lips, or throat. But the risks of an untreated opioid overdose are much greater than any possible allergic reaction. Of course, death is the risk, really. We'll take the allergic reaction. And first responders will be able to address any allergy-related complications when they arrive. So if the person's only sleeping, naloxone won't cause any harm. We'll make sure they're not sleeping. If the person is under the influence of another substance, naloxone won't cause any harm. And if the naloxone's expired, it won't cause any harm. As a matter of fact, if you ever do have expired naloxone and that's all you have, absolutely use it, because in all chance or all likelihood, it's probably going to work just fine. We recommend you to keep it inside the expiration dates, but that's still good information to have. It could be multiple years past the expiration date and still work. So just so you know. And naloxone can be given multiple ways. It can be injected directly into the muscle. That's called an IM injection, and those are the kinds of kits I brought today that I'll hand out at the end. There's also a nasal spray that you can see in the top right there, intravenous, which is only done under the care of medical professionals. And it's approved for use at all ages, and while the medication involved is the same, the dosages, administration steps, and costs may vary between the types. And this one right here was called Evzio. That was like a little computerized auto injector, which is a really cool device, but it costed, thousands of dollars. So that makes it difficult to get it to people who need it. Steve's Law expanded naloxone access in Minnesota, and anyone in Minnesota can carry and use naloxone without a prescription. Pharmacies can and should have naloxone available both by prescription and over the counter. And pharmacists can issue a prescription on site, and those prescriptions can be third party, meaning that they can be issued to a person who's not the person who intends to use it. And stores can also now sell 3 to 4 milligram nasal naloxone over the counter. When you're looking around in the pharmacy, sometimes, depending on the geographic area you're in, they might try to hide it because they're ashamed or whatever the case may be. Sometimes it's right in the open. Sometimes you got to ask the pharmacist. But the retail price is usually around $45. So right now.
Costco's the only one that has it around here.
Really?
And it's about $50 because I just picked some.
Yeah, they do have it at Walgreens. I saw it at a Walgreens, but that was in St. Paul, so I don't know.
They do have it at Walgreens too.
And
Yeah.
Target has it too. It's just like $45.
Oh, they just don't want to tell anybody.
Yeah, well, yeah, that's the thing. Sometimes it's tucked away and stuff. So yes, it's unfortunate, but sometimes you do have to like ask somebody. But also, many community organizations provide naloxone to the public, and the Steve Rumler Hope Network partners with many sites as naloxone access points, and I'll talk more about those a little bit later here. In 2014, the Minnesota State Legislature passed Steve's Law, which is Minnesota's naloxone access and Good Samaritan expansion, and it allows all first responders and lay people to carry and administer naloxone. It also expands naloxone access through pharmacies and third-party prescriptions, and very importantly, it provides civil and criminal immunities when providing assistance for a suspected opioid overdose. I'm going to elaborate on what those mean. This is more life-saving information right here, and when there's life-saving information, I really encourage people to share it, because sometimes information saves lives. So the civil immunity part of this means that an individual administering naloxone doesn't face any civil liability for the outcomes of administering the medication. And those are called Good Samaritan protections. They're there to encourage people to provide help. And it protects you if you get sued or something, whatever the case may be. If someone were to try to sue you and say they didn't want their overdose reversed, that protects you. But the criminal immunity side of this is also very important. And it means that the person experiencing the overdose and the person calling 911 to seek assistance can't face charges for use, and they also have limited protection from charges for possession of substances. They also can't have their parole or probation revoked due to activities covered under the above immunity. And you'll see a lot of links to our website on here, and you can get more information and stuff on our website. But I just wanted to point out, I also did bring a bunch of informational resources which are on that table over there. And one of them is this orange card. This is our Steve's Law card, so it kind of expounds on it a little bit, including like how many grams of different substances someone could have on them and be protected under the law and stuff like that. I've also got this resource card that you could put in your wallet or give to somebody maybe who might be interested. It's got a little QR code. It'll take you to our website. So, and there's a few other things over there too, including my business cards, if you ever want to reach out. So we'll start the administration steps, but any questions so far? Okay, well, we'll continue. We'll do the intramuscular, and after that we'll do the nasal. But real quick, recall the signs and symptoms of an opioid overdose. So if someone's unconscious or unresponsive, the slow or shallow breathing, pinpoint pupils, gasping or gurgling, a slow heartbeat or low blood pressure, and cold or discolored skin, which varies based on skin tone. If you see so before we do this injection, there's a few things that we have to do. But we'll start off with, if you see the symptoms of an overdose, try to wake the person up. You can do that via yelling, tapping, or gentle shaking. If they're not waking up, then we know it's a medical emergency. So the next step is to call 911 and say that someone's unresponsive and not breathing, and make sure to give your location, the exact address if possible. And then we'll open the naloxone kit and take out the items. And here's what's in each kit, but I'm actually going to pass a few of these things around. So each vial, there's 3 doses that come in each kit, and each vial has a milliliter, so it's not like a full vial. There's just a little bit of liquid in there. And I'm going to also pass around a vial that has the cap removed, so you can see there's a little rubber stopper. That's where the needle goes through. Damon's already seen this before, but I will pass this around here so other people can see it. It also has 3 intramuscular syringes, 3 alcohol wipes, 2 nitrile gloves, a breathing barrier, and an instruction card. And the instruction card comes in 4 languages. I think we have a Korean one too, but this is as many languages as was fit on a instruction card. But we try to make it as widely readable as possible. But this is useful too if you were to panic or forget something, or someone might come across one of these kits and maybe they didn't take the training, so it's useful for a variety of reasons. Real quick note on rescue breaths. So rescue breaths help to circulate oxygen during an overdose emergency. If you don't feel comfortable or confident administering rescue breaths, naloxone alone will still have a positive impact. It's a personal risk assessment for everybody. Obviously, we got COVID going around still, which people are still getting really sick from that. This is the breathing barrier, and it's basically a piece of plastic with an outline of a person's face. So you put it over their face, and this mouth part is like a little filter, so it'll protect you from bodily fluids. And there's a lot of different kinds of breathing barriers out there. That's a little bit cheaper of a one. If you were like an EMT or something, you would probably have something with like a valve on it even. So there's a variety of types of those.
A breathing barrier is available at the pharmacy.
That's a good question. I've never checked actually, so I don't know. She was asking, are breathing barriers available to buy at the pharmacy? They might be. Yeah. If not, I bet they would know where to get them.
You can get them online or at medical
Yeah, you could do
stores.
that, yeah, that's fine. But they might come in bulk.
Yeah. Unless maybe if you're buying a higher end one, they might have individual ones. So the first thing, oh, sorry.
Can I ask a
Yeah.
question a little bit before I was supposed to ask?
Sure.
If you're not certain that it is overdose and could be heart attack,
Yes.
sometimes it's really difficult to figure it out.
Mhm.
How much harm can do Narcan to a person with a heart attack? Could it be bad, or could it
No.
still be okay?
Yeah, it's not going to make the heart attack worse.
Okay,
Yeah.
but it's not gonna help either.
Well, yeah, that's why, it's best to keep learning. If you knew CPR, if you know more,
Sure.
you might be able to recognize that it's a heart attack and not an overdose. And that's why we went over the symptoms, pull down the eyelid, see, is there the pinpoint pupils? I mean, but the thing is, yeah, I mean, the way
Yes, of course, that's.
in the way EMTs approach it too is EMTs are very liberally using naloxone. So they will give naloxone when they're not 100% sure it's an overdose because it has such a low risk profile that it's not really a big deal. Yeah. But okay, so good questions. So the first thing we're going to do is just give a couple rescue breaths just to get some oxygen into the person's system. So put on the gloves and the breathing barrier and use one hand to gently lift their chin and tilt their head slightly back. That's just to open up the airway a bit. And then pinch their nose shut and make a tight seal over their mouth with your own mouth and breathe out into their mouth for 1 second and provide 2 test breaths. And we want the chest to be rising. That's what should happen if it's going into the lungs. It's possible to go down the wrong tube and you see the stomach rising. You just have to go back and reposition their neck, just like is shown in figure A. And then I'm going to demonstrate this actually, but we'll go through the slides first. So the first step is to remove the plastic top from the vial of naloxone, and then remove the syringe from its wrapper, and then carefully remove the protective plastic cap from the syringe. And the cap on these syringes just pulls straight off. These are called Luer lock syringes. So they're designed to be removed. You can see if I go like that and unscrew it, and then if I wanted to, they hook it up to IV tubes and all kinds of stuff. That's why they're like that, but we don't need to do that, so just make sure to just pull it straight off. And then we're going to use something called the vacuum method to get the medication into the syringe. And the way that works is there's volumetric measurements on the syringe, so we're going to actually draw air up into the syringe. So we'll pull down to the 1, and that's 1 milliliter of air. And we're going to inject the air into the vial and then flip it upside down, and we'll let go of the plunger, and it's going to push all that, it's going to create pressure in the vial and push all the medication into the syringe. And you can see I'm putting the air in this animation here. And like I said, I'll demonstrate this too. But in the next animation, you're going to see it's flipped over, and they'll be letting go of the plunger. And you see how the needle is just barely inside of there? You want it right at the bottom, kind of like almost like acting like a floor drain inside of the vial. Just all of it's getting pushed down. And you might have to pull down the plunger a little bit just to get the rest out of there. That's a possibility. But each vial is 1 dose. And after that, remove the needle from the vial after drawing up the dose and push out any large air pockets. You don't have to worry about small air bubbles, and I wouldn't, you don't want to waste any medication trying to get every last bubble out of there. It's going into a muscle. It should be directed directly into a large muscle. So the upper arm muscle right here, or the upper outer thigh muscle, are ideal. If those are inaccessible, the upper outer buttocks is also an option. And this allows for the medication to be quickly absorbed into the bloodstream. And the needle can actually go through a thin layer of clothing if necessary. These are larger gauge intramuscular needles. It's not really the type of needle that someone would typically want to use to inject drugs with. And because they're thicker, yeah, it allows it to go through clothing. But just make sure if you do go through clothing, there's not like something in their pocket. Like I got a bunch of stuff in here, so if you tried to go in, you'd break the needle. So just make sure to check. And then if you're going through clothing, you're going to skip the next step here, which would be to expose the skin of the upper arm or thigh and use an alcohol wipe to clean the area. Sure, if you're not using the alcohol wipe and going through clothing, maybe they might get an infection, but it's better than dead. And then hold the syringe like a pencil, just kind of like they're showing there, and insert the needle at a 90-degree angle into the injection site. And make sure to get through the skin and fat layers and into the target muscle. That's very important. And then switch your hold on the syringe to prepare for injection. There's little handles on the syringe, so you just hold it like that. And when you're holding it like that, you've got it placed, then push down firmly on the plunger to administer the full dose of naloxone. And if possible, immediately put the used needle into a sharps container. If no container is available, the syringe may be recapped carefully. And that's because, so if you're ever in a place where there's a sharps container, always put it into the sharps disposal container. But it's a possibility that you could be out in public and there just isn't one available. So that's why this advice is here. But always be careful not to prick yourself with the needle. When you're recapping it, you just scoop that cap up with one hand. Then you're not using two hands. You can't poke yourself. And I'll show you this in a second. But you scoop this up like that, just like they're showing, and push that cap down. But always be careful with sharps. Even before you've used it on the person, you can't accidentally poke yourself and use it on them. There's always a risk of transmissible infections. And it's easy to do if you try to just stay calm, don't panic, and follow some of these tips. You can be careful with them. So I'm going to demonstrate this, and then the next step is to check their breathing. Let's see here. I've got so I actually forgot to bring an alcohol wipe with me, but so I'll skip that step. And in reality, I think people are skipping that probably a little bit more often than we would like to think. But so the first step here is I'm going to draw a milliliter of air into this, and I can do that without even taking the cap off, actually, just like that. I'm going to take this plastic cap off of the vial, just like that. Just flips right off. And then I will remove this cap and set it down. And the way you get this needle into the vial, it depends on if you've got shaky hands. You know, you can put it down on a surface and go in like this. That's probably going to be the ideal thing for a lot of people. The way I do it is like this. You can brace one hand against your forearm like that and just go right on top of this and insert the needle into there. And then I'm going to inject that air into there and let go, and you can see it's pushing it down into there. And now we've got it all, so I'll pull that out. And there is, in fact, a little air bubble in there. I don't know if you can see it. It's pretty big. So we'll get that, and there we go. That's good enough. So I've got the air out. And then here's my dummy arm. So this dummy arm has a, you can see there's a muscle in there, there's a fat layer, and there's a skin layer on the outside. So I'm going to hold this needle at just like a pencil like this, and I'm going to go directly in, just like that. And now that's into the muscle. So I have it placed. So I'll switch my hold on it, just like this, and then I'll push down the plunger and administer that dose. And now I'm going to remove this, and we'll pretend like we don't have a sharps container. So the way I'm going to use one hand and just scoop this cap up like this. So I scooped it up, and I'll just push it down just like that. Okay. And then the next step is to check the person's breathing and provide rescue breaths, and it's one breath every 5 seconds for 2 minutes while waiting for the effects of the naloxone. If there is no improvement in the person's condition after 2 minutes, you should administer another dose of naloxone, and you can do that by repeating the previous steps, ideally switching the injection site if you can. But make sure to wait that full 2 minutes, because this medication, it takes a while to kick in, and actually it's still absorbing even past 2 minutes. But a lot of times people tell us these stories where they've used a lot of doses of naloxone, and in most of those cases they just didn't wait very long before giving the next dose. So that's a lot of times what has happened. So we're going to talk about the nasal spray, but any questions so far? Any questions on that intramuscular? Mm-hmm.
When you do the actual injection, do you ever see some of the liquid come out on the skin? Because that happens with other shots sometimes.
Yeah, it can happen.
Yeah, and that's not alarming.
There's just nothing you can do about it. Yeah. Now most of it will still be in the muscle, but yeah. Sometimes you do see that. Good question. I'm going to pass around a nasal applicator. This is a demonstration one that you can actually push the thing down just to take a look at what it looks like. Okay. And then we'll go through the nasals pretty short, and then we just got a few tie-up items at the end. So there's a variety of brands. There's a 4 milligram generic. There's a Narcan branded one. Revive is like a non-profit organization. That's really cool that I like. 3 milligrams. This one's 8 milligrams. It's called Clixado. That's like 2 doses in one, which in my opinion is not ideal, but these are all FDA approved, and they work to reverse an overdose. So prior to nasal administration, kind of like before, attempt to wake the person up. If they're not waking up, call 911, open the kit and take out the items, put on the gloves and the breathing mask, and provide those 2 rescue breaths. And then lay the person on their back and remove the first dose of nasal naloxone from the package. And when you take the nasal naloxone out of the package, make sure to hold it like this. Keep your thumb off to the side. You don't want to put your thumb on the plunger because you may accidentally press down the plunger and dispense the medication. And that would not be good, obviously. And then gently insert the tip of the nozzle into a nostril. Am I standing in your way? Okay. All right. So gently insert the tip of the nozzle into a nostril until your fingers on either side of the nozzle are against the bottom of the person's nose, and use your thumb to firmly press down the plunger and spray the medication. And try to keep it oriented like that. You don't want to spray it too far that way or too far that way. It's got to go into the nasal cavity. There's a mucous membrane in there, which is where it's absorbed. And then once you're done spraying it, remove the used applicator from the nostril. And just to let you know, when you get a nasal kit, there's usually 2 doses in it. So the IM, there's 3 doses. Nasal kits have 2. Even if you get them from the store, there's 2 in there. So we've got it administered now. And we're going to, kind of like before, check the person's breathing and provide rescue breaths. and it's one breath every 5 seconds for 2 minutes while waiting for the effects of the naloxone. If there's no improvement in the person's condition after 2 minutes, then you should administer another dose of naloxone, and you can do that by repeating the previous steps. But with the nasal, make sure to switch nostrils. Someone could have a deviated septum, maybe there was something blocking or whatever, so that's kind of the reason behind that. And then we'll wait for help to arrive. So if and when the person begins breathing, don't leave them. Help them into the recovery position if possible and monitor their breathing. It's important to stay with the person until help arrives. When the naloxone wears off between 30 to 90 minutes, the person can actually slip back into overdose again. And if that does happen before help arrives, then you're going to need to administer additional doses of naloxone. That's actually a really common thing that happens, so that's good to know about. But yeah, this is what the recovery position looks like, because the person's on their side, the knee is out to stop them from rolling onto their stomach, their hand is supporting their head. It helps keep the airway clear. It's also possible someone could vomit. This kind of helps to prevent them from choking or aspirating, things like that, so there's a lot of reasons behind it. As far as how someone might react, it's hard to know how a person will react when revived from an opioid overdose. Many factors can influence their behavior. One of them is opioid withdrawal. So naloxone induces a temporary but immediate withdrawal, and symptoms can include nausea, sweating, disorientation, and body aches. And that's often misunderstood as side effects of naloxone, but it's not. It's just if our bodies are dependent on an opioid drug and we take it away, then we feel sick. Also other substances. So naloxone only counteracts opioids in the body, and other substances may remain active. Individuals who have taken other sedatives, including xylazine, may begin breathing but not regain consciousness. And that might be pretty alarming, because a lot of people are expecting, well, they're not waking up, like what's going on? And you might have still saved their life. We're worried about the respiratory rate and their O2 levels. But yeah, if someone is under the influence of something where maybe they're going to stay asleep or passed out, that's a possibility. And then last but not least, a emotional response. So individuals revived from an overdose may be fearful, sad, frustrated, embarrassed, or confused. And oxygen deprivation can cause additional stress and disorientation. But none of these possible reactions should prevent you from administering naloxone to someone in need. If someone is experiencing an overdose, getting naloxone is their best chance to survive. If and when you feel comfortable doing so, consider encouraging the individual to seek future help or treatment for their substance use. And that's probably not going to be right after you revive someone from an overdose. I don't think that's a good time for a pep talk, but at some point. And I always like to mention, like, try to, like, if you can, take a moment sometimes to center yourself and remember that there's people out there who don't have anybody to talk to. You might be the only person they have to talk to, or maybe they don't feel safe talking to anybody else, and you're kind of like their person. And we're just so busy all the time in America. There's so many distractions that it can be very easy to forget that. But we need each other, and some people need us more than we even know. So as far as scene safety, always be aware of your surroundings. Avoid any tools, pipes, needles, etc., or substances on the scene. Stay alert to other potential hazards like street traffic. Always use the protective items included in our naloxone kits when administering rescue breaths and naloxone. Avoid touching your mouth, nose, or eyes, and wash your hands after. When EMS arrives, allow them to take over assisting the individual and answer any questions the first responders may have, and exit the immediate scene. But always prioritize your own safety. If anything is making you feel unsafe, remove yourself from the situation, call 911, and wait for EMS to arrive. As far as used supplies, they can all actually be given to a first responder for disposal. You can recap it and put everything back in the kit and let them know. Obviously there's sharps in there, let them know what's in there. But otherwise, used syringes should be, or used needles should be put into a sharps disposal container or some kind of rigid plastic container. A detergent bottle works. Never use a glass container. And there's a variety of services available to dispose of collected sharps. And as far as the vials and nasal applicators go, naloxone is actually non-toxic, so you can throw it out in household trash, but just remember that those are small components, so they could be a choking hazard for children or pets. It keeps best at room temperature. We should always avoid extreme temperatures, both hot and cold. Kits should be stored away from direct sunlight. They are packed in UV-resistant bags, but it's still best to keep it away from direct light. And naloxone has an FDA-required expiration date of 2 to 3 years. You can reach out to us at Steve Rumler Hope Network for a replacement kit, and you can return expired or unused kits to us. Here's an example of some of those expiration dates. If you ever need more naloxone, the Steve Rumler Hope Network partners with community organizations, clinics, and businesses as naloxone access points where anyone can get naloxone. And you can find your nearest NAP, as we call them, at rumlerhope.org/NAP. Or if you go on our website, there's a menu at the top, and there's in one of the drop-down menus, you can find it in there. If you click on that, it'll pull up this map, and we can zoom into Minneapolis and see what's near our neighborhood. And if you click on one of those little pins, it'll say what clinic or business it is, what address, what the hours are, and yeah, you can just go swing by and pick one up for free. But it can also be requested at most pharmacies or purchased over the counter. If you ever need fentanyl test strips, we do offer those at our NAP partners as well. I also brought some today, so if anybody needs any of these. And what they are is each kit contains 4 strips that can be used to detect the presence of synthetic opioids and other substances. So they're actually a harm reduction tool, and they're designed for people who use drugs. And the goal of these is to keep people more informed about their use. So, and then hopefully they can make better decisions about their use. So for example, if I wanted to use meth, maybe what I would do is take like a little bottle cap of water, like I've got my bottle over here, here's my bottle cap, and I would take like a grain of rice-sized sample of the meth, mix it around in there really good, and then I'll take one of these strips out and dip it in there, and some lines will appear on it, and then I can compare that to the instruction card, and if it tests positive for fentanyl, maybe I won't use it then. That would be the ideal case scenario. But there's other ways too. They could use with other people, number one, so if something happens, they can at least call 911. Ideally, someone who has naloxone. Some people they're still going to use it even if it tests positive for fentanyl, because everybody is using different substances. There's a lot of reasons why people use substances. They're always different. And there's also, so this is another piece of life-saving information. There's a number called the Never Use Alone hotline, and they will stay on the line with you while you use. And if you go unresponsive, they'll call 911 for you, and folks are protected by Steve's Law still. So, share that information if you can, and we try to get as many of these out there as possible. Everybody should test their drugs if they can.
How do you test that, the strip?
So,
Orally?
no, so like I said, you take like about a grain of rice-sized amount of the drug you're going to do, and you mix it in like a bottle cap of water.
Okay.
You get a bottle cap, mix it around, and you dip the strip in there,
Okay.
and then you just got to wait like a little while for the lines to
And
appear.
Only with a gloved hand.
Only with a gloved hand, she said. You wouldn't want to contaminate it.
Okay, or end up
Yeah.
using naloxone.
So if you ever want to support our network, you can click donate on our website to help support our continuing work. Also, if you ever want to volunteer, we love our volunteers because all these kits are hand-packed by some awesome person in the community who decided that this was important and decided to help out for free. They make our mission possible. Also, become a partner and advocate for naloxone and reduce stigma in your community. There's a lot of misinformation. Sometimes there's hateful things or stigmatizing things, and our voices are powerful. So, use your voice. It can make a big difference out there. But to summarize, naloxone is a life-saving medication, and it's an important tool for public health. Steve's Law offers both civil and criminal immunities for overdose response situations. Naloxone can be carried and used without a prescription in Minnesota. People in Minnesota can get no-cost IM naloxone from the Steve Rumler Hope Network or any of our partnered NAP sites. Nasal naloxone can be purchased from most pharmacies over the counter, and you can revisit instructions and videos detailing naloxone administration on the Steve Rumler Hope Network website. And here's that QR code I mentioned at the beginning. If you wouldn't mind scanning that with your phone, we'd love to know what you thought about the training, but that's also how you get your certificate. And it'll email you your certificate, and if you want CEUs, you can get them that way. It's going to ask you my name. My name is Dan Kelly. And so I'm going to give folks a few moments to do that. I really appreciate you coming out here today. It means a lot to me. And I'm also going to take this time to, we'll open it up for questions, but I also wanted to see if Damon wanted to maybe share real briefly maybe some of the things that helped you in your recovery since you're here and we're celebrating this cool day for you. If you want to stand up for a second.
Okay. Hi, I'm Damon. I've got 3 years clean today, and I overdosed needing the assistance of Narcan twice. And one of them was administered by the EMTs, which, so it saved my life. I used some drugs and passed out in the garage and hit my head on the ground and breathed in vomit because I vomited while I was unconscious and needed the EMTs to come in and give me Narcan and also clear my airway. And it was a complicated thing that wasn't necessarily easy to do for the people I was around. My girlfriend at the time wasn't able to do this. So, and that was another thing, like she was challenging, having a difficult time calling 911 because of the stigma involved. She was ashamed of calling 911 and struggling with that. And so that's another important thing that we have to do is reduce the stigma associated with drug use. And so I think that everybody should have one of these in their medicine cabinet because opioids don't discriminate and anybody can overdose. So,
Thanks for sharing, Damon.
thank you.
Thank you. Congratulations.
Thank you.
My name's Dan Kelly.
How do I do this?
Oh, you want me to do it for you?
Would you please? I tried like in a restaurant to do menus and I've never been able to.
Oh, well, okay, there it is.
I work at JFCS.
Got it.
Their addiction.
There you go.
And now how do I find certificates?
So you just got to go down and fill this out. So you go through here. You want a certificate of completion.
Yep. A resource
Um,
guide that we've been working
You put your
on.
name in there. You put your last name. You just kind of have to go along
We're
the
also
process here.
our
Got it.
department.
Thank you
You're welcome.
so much.
Yeah, here's a kit. Do you want fentanyl test strips too?
Sure.
Okay, there you go.
Now tell me how you use this again.
Well, these are
What if
mainly
there aren't
designed.
any drugs to test?
Well, these are really designed for people who use drugs to like keep them safer. So like if you know, unless you know someone
Oh,
or
like you find some in a medicine cabinet or something?
My name is Jennifer.
yeah, if you found like unknown pills in your medicine cabinet for some reason, then yeah, you're not going to get something from the pharmacy that's going to have fentanyl in it unexpectedly. That's not going to
So
happen.
should I put down no, I got a kit? for-
Yeah. Oh yeah. Sorry. Well, it's too late.
There's a mistake.
Is there?
It's just updated.
What?
And then
What?
hold it up
My
like this,
BLS
take a picture of it.
Oh, what slide is it?
It's the rescue breath.
And now hit
one
that,
every
the
six.
yellow word, the
Or
yellow
what?
words
One
there.
every
6? Okay, I'm gonna bring
Yeah,
that
I
up.
don't know when they changed
There you
it,
go.
but it's annoying.
It was in what certification? BLS, you said?
Now you're good.
Yeah, I work in a hospital.
Okay.
To get recertified on
Okay. Yeah. Okay, I'm gonna let them know.
Yeah.
What's that?
Sometimes-
basic life support.
sometimes
Yeah.
you can-
Oh, basic life
So
support.
memorizing
You are
all these
most
stupid
through your
numbers.
camera.
Okay,
My
yeah.
test.
Well, no, that's good information. Appreciate it.
So, yeah, you can pick
Sure
up the
thing.
lock
Yeah,
phone
thanks for your
from
work too,
JFCS
by the way, that you do in the
and call
community.
them.
I work in addiction.
The
Oh,
other
great.
thing is
Well,
that if
even
you're
better.
comfortable using the spray, the nasal spray,
Here you go.
one of the easiest ways to get
Welcome.
that for free is Fire Station 21. They have a
There you
vending
go.
machine where you just drive into the parking lot at the fire station. You don't have to go inside. You don't have to show your ID or anything. You
Yep.
just press in a number for the vending
Here you go.
Yeah, absolutely.
If
You're welcome.
anybody knows any veterans, the veterans, military veterans can get free naloxone through the pharmacy.
I also wanted to mention too, you know, check with your insurance because sometimes they actually do cover it. There you go.
Oh, yeah, thank you.
You're welcome.
Yeah, and I live with, Steve from, University Avenue. That's right.
Oh,
And I
really?
used to pack those things.
Well, why don't you swing by sometime? We're,
That was in, Edina.
yeah.
Yeah, and
Yeah.
my brother was a volunteer for a long time. too.
Oh, well, thanks for helping
Yeah,
out.
volunteers live there.
Oh, yeah. Yeah, no, we appreciate it. Yeah, if anyone ever wants to stop by and say hi, it would really make me happy.
Where are you guys at?
We're right off University, kind of by Hampton over there.
Where is
It's by like Vandalia
So,
on
I
University.
don't know, I've lived here a long time, but I still don't know everywhere.
Yeah, like there, you know where the Menards is in St. Paul on University? It's like pretty close to there. It's like maybe a couple, 2-3 blocks. Which direction is that from? Is that, it's east, right?
West,
Or is it west?
west of Menards.
West of Menard?
Is it towards like Dale, those places?
No, opposite.
Oh, the other side,
Other
towards
side.
the university?
Yeah, it's west
Yeah.
of Vandale.
You know where
Yeah.
Snelling.
Oh, yeah, I
It's
know.
west from Snelling. Just yesterday was on the news about that area on Snelling.
Oh, really?
It's really, it's a guitar shop, Midway, and what do you call it, about a lot of needles and drugs around.
Hamlin.
Hamlin, yeah, thank you, yes.
The guitar shop?
Yeah, it's a guitar shop that the owner was actually talking about that she's even ready to move of the
Oh.
area because a lot of drug going on there and they found people being unconscious, whatever,
Mm-hmm.
We had
Yeah.
a party on Friday night at the park there for the people actually.
Are you associated with the Hope Restaurant?
The Hope Restaurant? No, I didn't even know there was one. Where's,
They have one, I think all of their, they donate, I think, most of their, money, whatever they make. I think they keep I don't know how it works, but, it's, they donate just about everything they make. It's in St. Louis Park.
Yeah, there's 3
oh, okay.
spots.
Well, I'll have to check that out.
It's
That's pretty
delicious
cool.
food, too, but
Yeah.
they have to put you on a time limit, got like an hour in there and then.
Oh, really?
It's very popular.
Oh.
It's reservation, 'cause
It's
there's
very
expensive. Hope breakfast bar,
Is it gluten free?
they have, I think, probably gluten-free options. They're pretty mindful.
Yeah.
Yeah,
Yeah, sounds good to me. I'll have to check it out.
they're wonderful.
Maybe we'll even celebrate Damon's 3-year anniversary over there.
Yeah.
Sure.
Does anybody, if anybody needs an extra kit, if you maybe know someone who needs one of these, I can give you an extra one if anybody needs it. Yeah,
I can give them away too.
sure. Yeah.
We're working with the group.
Here you go.
Thank you.
If you got a lot that you want to give away, I'll give you my card and you can reach out.
Oh, okay.
Okay.
I think I did pick up your card just because of that. I was thinking of.
Yeah, no problem. Was there someone else?
The next time you have kind of a resource to have me there.
Yeah, did you get another one? Yeah, you got one. Let me get a card for you. Yeah, I've got business cards over here. Feel free to reach out if you ever got a question about anything.
I'm glad I picked your
Yeah, thanks for coming. Really.
class I had was like, when they first came out with the kids, and
Uh-huh.
I remember nothing.
Oh, yeah,
It was
no.
like years ago.
Yeah. Yeah, and we rely on people like you to give us, information like you just gave me too.
Oh, because I'm studying for my test.
Yeah. There you go.
Oh, great, yeah.
You're welcome.
To become a volunteer, do you have to like volunteer a specific amount or like take a training course or anything like that?
No. We actually, we had a lot of people volunteering who sign up, and so we're like fairly well covered on at least our kit packing events and stuff like that. But if you're interested in becoming a trainer, if you want to give trainings like this, that's a possibility. If you are looking for something, a way to give back, Here, I'll give you a couple. Did you get some of these things up here?
I didn't take the long one, I think I took the business card though.
You took the,
Can I see it? I can't see that.
that's my business card.
I took that one, but I
Okay.
didn't, I already
Okay.
have this one, I don't
There
wanna
you go.
steal another one from you. Thank you.
You're welcome.
Hey, thanks so much.
Yeah, you're welcome. Do you need an extra one?
And maybe they don't give them to us.
What?
I'm trying to get them in our clinic, but they won't give them to us.
Well, that's a bummer. Do you need, does anybody else over there need any?
Yeah,
Do they?
maybe. I could give it to one to our medical director.
How many do you think you need? I'll give you all these if you want.
No, maybe, I don't want you to do that. Maybe a couple.
Couple? Okay. There you go.
Thanks.
Yeah, you're welcome.
Thank you so much.
You're welcome. Thanks for coming, everyone.
Is it safe to transport in a plane in a suitcase?
Yes.
Because I wanna take.
Yeah, it is.
Some.
I mean, I'm supposed to.
Sure, no problem.
But the thing is, where are you going though?
What do you, like?
Like you're going overseas or